Hello, hello. Welcome back, everyone. Welcome back to the podcast. So glad to be back recording once again. A lot has changed. So I'm going to go through all the changes that have come to this podcast, to social channels, to the brand, and some new courses that I have developed. So I know in my last podcast episode, I was talking about the direction and kind of the rebrand of the CT Educator. Well, the podcast has a new name, and so do all my social channels. So I went ahead and did a lot of thinking, and I wanted something to represent me and my expertise in the CT space. So I went ahead and rebranded, and I'm super excited about it. And the courses that I have developed, awesome, because it's been highly requested. So I am going ahead and delivering. And one thing that did happen is I'm not sure if you all follow me on TikTok, as I think most of you do that do listen. My TikTok account got hacked on April 26th. And apparently it had been happening to thousands of people all across the app. And it took me 3.5 months. On June 20th is when I regained access to my TikTok account once again. I had to go through a whole spiel where TikTok had to, verify all my information. I had to give them a lot of information to verify that I was the rightful owner to that account. So, and it was just hell because I had to create a backup account and try to grow that account. And those things were frustrating. So yeah, it's one of those things that just threw me for a loop and kind of made me want to just stop doing social media altogether. But I'm glad I didn't. I just stuck with it and it worked out for the best. So now I'm back on TikTok. It's got a new name, which it will have the same name to this podcast in a couple weeks because I just had to kind of give it a name. I wasn't sure what name it was going to be. So make sure you check out the show notes. All the links will be there. I have a new site for all my courses, which is pretty structured and it's more easily tangible so my students can go through it because I had a couple of different sites. So I'm just combining everything and making everything very simple just so that you can go through all the lessons and learn what you need to learn as a new technologist. I've also come up with a 10-episode private podcast series that you can check out on that website as well, and you can binge it. So I've gone with the platform School, which does have an app, and you can listen to these episodes and even the trainings on the go. So you can listen while you mess with your kids if you have downtime at work or, you're driving home in the car. So it's very easily accessible. So make sure you check out the show notes and check that out. So let's get into today's episode because today's episode is going to be very juicy. And I'm going to tell you why this episode was created. So I have had a few videos on TikTok that have gone viral. And I will link the videos in question that sparked a lot of conversation when it comes to CT protocols and the technologist's insight and knowledge versus the radiologist's expectation and their perspective. So there was a ton of comments, and I know I had responded to some of those comments either written or by video response. And it sparked a very good conversation, and it gave me a very good idea on how I can better not only bridge the gap, but better help those technologists out there with the concerns that they had and the comments that they left on my videos. So first, let's explain the past versus the current dynamic when it comes to technologists and radiologists. Now, I know that some of you that do listen are old school technologists like myself, 20 plus, 30 plus, maybe 40 plus years in the business, maybe more, and still doing it. And we had a different dynamic back then than we do now. The dynamic back then is we had radiologists on site. They were there. They sat in the dark room. This is the days of, dark rooms and film and developers and fixers and chemicals, if you all remember that, because I do. Even to this day, I think I can still smell those chemicals because that's how long, I spent in the dark rooms and x-ray. So we remember those dynamics when we had an interesting case. You would walk into the reading room and say, hey, I have these images. Can you teach me something? And they would teach you a lot and what to look for and how to find things and when you were scanning or even x-raying patients, right? So here's the other thing. That dynamic has changed. And the way it has changed because a lot of it has moved to transitioning from being on site to remote radiologists. And there's a few reasons for that. One of the reasons is COVID really just kind of dampened all that and moved those radiologists off site to being more remote. And I know this has happened at the level 1 trauma center that I work at, where we did have overnight radiologists. And guess what? They transitioned them and, they were remote. Now, the other reason that this has happened as well is money, of course. Okay. And I know sometimes we're afraid to talk about money, but a lot of hospitals want to save costs any way they can. So what they do is they will outsource radiologists, especially at night. Some facilities do have it during the day. It just depends, where they will use a Nighthawk, like a third-party vendor, something like StatRad or VRAD or ERAD, to save costs. Or they have a group of radiologists that may be in another state, and they are just remote radiologists that are reading for somewhere, let's say in Indiana, right? So, and that is to cut costs instead of having somebody in-house and paying that radiologist money to read. That has been one of the things that has really just hit hard with the dynamics as far as communication between the technologists and radiologists. Now, let's talk about the lack of communication. Now, this transition kind of dampened the communication because you can't just walk down the hall and say, hey, I'm going to go talk to the radiologist, or if you have a contrast reaction, let me go grab the radiologist that's down the hall. That practice, has, kind of dwindled. I know at a prior hospital I worked at, they would have radiology residents at night. So you always had a radiologist on site, So those are one of the things that has really just, hampered the communication between the tech and the radiologist because of the outsourcing. Now, the other thing that I see happening is there's not a lot of communication between techs and radiologists. And I will give you a prime example because there was one situation at a hospital I worked at where the radiologist did not want to be bothered, at night with questions or this or that. They gave us a protocol via email and said, okay, you follow this. If it's outside of, these parameters, then yeah, you can call us. But other than that, we're just going to approve it. Now, that kind of puts a little liability on, okay, do I feel comfortable doing this exam? Should I do this or do that? Because it relies heavily on the techs. And radiologists have this expectation that, okay, well, you have a protocol book, you should know everything. It's not always the case, okay? It's not always the case because I can tell you there's a lot of radiologists that I've come encountered with that I've asked about protocols and they just say, just do whatever they ordered. And it's not how it's supposed to be. Where I've seen other places that radiologists will protocol everything before you even scan anything because they're the ones reading it. They're the ones dictating it. They want to make sure that you do the correct exam. So it kind of goes both ways. Okay. Now, one of the comments on one of my videos is the lack of respect towards the CT technologists and the radiologist's expectation of knowing all the protocols because they are just there to read it. And why are you calling me about something you should already know? Here's the thing. Ordering physicians and other providers will order things that are really, really out of the norm. Okay. And a lot of times they're funky orders, okay? And some of these orders, you're like, okay, this is bullshit. Why are we doing this? And then when we question, those ordering providers just say, well, I'm looking for such and such. Okay, well, you need to do this exam. And they have no clue. So since we are under the direction and the guidance of the radiologist, normally we're going to ask him, listen, this doctor ordered this. I'm not really sure how to proceed. What do you think I should do? Now, there is where there needs to be a positive collaboration and we can give them a full medical history of what's going on with the patient. They have access to look at the patient's chart and they can really direct us on, okay, you're supposed to do X, Y, and Z. Or they can just call the provider themselves. That piece completely seems to be obsolete now because it seems to me, and I know this is going to trigger people, that radiologists do not want to have a say in what goes on with these radiology orders that come in, but want to complain and disrespect the technologists about why the fuck did you do this? When we simply ask questions and then you go back and that's not what you wanted. You cannot have it both ways. Okay. So what I'm getting from the comments that I got on my video is that radiologists have this expectation that we need to know it all. And, that they seem to be under the impression that we have all this wonderful training and knowledge. It's not always the case. A lot of times there are technologists who don't get the proper education, don't get the proper training. And when they're learning, it's impossible to learn the amount of protocols that radiologists go ahead and expect us to do. Now, where do the protocols come from? And I mentioned this in one of my videos, responding to a radiologist, that I will link in the show notes. I said these protocols, when they're created, they come from you. It comes from your group. It comes from you that is reading the exam. It doesn't come from the technologist. What I see here is that it opens up the technologist for a lot of liability, which they don't need to be. And when we're questioning something, radiologists like to put us in the middle when it should be a physician to physician conversation. So I am talking about these topics because there needs to be more awareness and there needs to be more collaboration where radiologists really need to take the upper hand and speak to the physicians about the orders that they're ordering. I know you're going to say, well, they don't have enough time. They're going to say, do what I ordered and this and that. But you have to remember, at the end of the day, it's in the best interest of the patient. Think about it this way. If it was your mother, if it was your son, your daughter, your aunt, your father, your grandmother, would you want somebody having a constant back and forth and they're getting repeated imaging? Or do you want somebody to advocate and make sure you get the correct exam? Just think about it that way. And I think if more radiologists were on board with us, it would be more of a positive interaction. And a lot of patients would not have the repeat exams that they would. So I think in the best interest of the patient, what needs to happen is there needs to be more positive collaboration between technologists and radiologists. Listen, I know there's some techs out there that radiologists can be real assholes and they can make their job really hard. And I've heard radiologists in the past that say, we need to treat our technologists better because they can make our job really tough. And in actuality, I agree with that statement because we can. However, it should not be that way. It should not be that way. We should be able to communicate that when we call you, that there's going to be respect both ways. Let me say that again, respect both ways, okay? So to the radiologists and to the technologists, because I've encountered radiologists in the past that are very disrespectful. One of the comments was, I don't need to sit here and hold your hand and you should know what to do, which is very disrespectful considering that we're both adults, okay? So, and then they should be there for guidance. They should be there to help us. They should be there to step in when something isn't right. And those are the things that I think we look for and we want. So those are my insights for this podcast episode. Make sure you guys check out the show notes. I'll link all those videos down in the show notes. I'll link down my new email address, all the new socials with the new names, and the website for all the new courses. So the next probably month's worth of episodes, it's going to be exciting. So I am going to drop 2 episodes every week starting next week. So you're going to get brand new podcast episodes here on the CAT Scan Guru. I love that name. Every Tuesday and Thursday. So make sure you guys subscribe, share this with a technologist that needs to hear it, like, comment, all that stuff, okay? And make sure you guys follow me on TikTok, follow me on Instagram, follow me on YouTube, because I'm going to be bringing you even more educational stuff. And we're going to talk about the mental health stuff as well, because I think that's a very important piece. So thank you so much for sticking with me through this rebranding. Thank you so much for listening, and I will chat with you guys next week.